thank you. I just finished making a bunch of lunch, so you're good. Thank you.
Which is missing?
I wrote them, but I'm trying to figure out which one I didn't put in. This one. They look the same though. That's why I didn't put it in, but this is no. Okay. Okay, got it. Do you take any vitamins?
Yes.
What type of vitamins you take?
I mean, just some like general over the counter
Multivitamin
thing, and I guess this. I'm not sure.
That's considered okay.
Yeah. I'm not 100% that's not or is. But that's the prescription side that I separated it.
Are you allergic to any medicine?
Yeah, tramadol. And milk protein, lactose, and latex.
And okay, so let me pull up your stuff, and I got all your meds. Have you ever been married?
No, ma'am.
Okay. Any hospitalizations in the last 3 months? Okay. Any doctor's appointments in the last 2 weeks?
Wait, no.
That would be back to like the 4th of September.
I'll check.
Okay. You have my chart?
Yeah, but I just have it on my calendar. I'm pretty sure I don't have. It did not have anything. Did I? Well, I had a bunch of visits from Aetna this month. Had a remote visit with my speech pathologist on the 9th at Ochsner.
So you do speech? Yes,
ma'am, speech pathology. My first appointment was on the 9th at 10 a.m. with Sarah Quintana, MSCCCSLP.
Which center is it? You said with Ochsner?
Yes, ma'am, Shreveport.
Any other therapy, physical therapy, occupational therapy?
Right now it's just her, yeah.
Just speech. And then, how many times is she going to have the sessions?
She hasn't determined.
Okay, so she's assessing?
Yeah, I see her again next week, I think, or is it the week after next? It depends. I think it would be, not the 3rd, the 8th, I think it is. I didn't actually write that one down on my calendar, okay. But yes, I believe the 8th, according to the Ochsner chart portal, and I have 2 appointments next week and 2 more this week.
Okay. And and what's your date of birth? Your date of birth?
05/22/97.
And the last 4 of your social?
8926.
Anybody, are you still making your own health decisions, or does anybody have power of attorney?
No, just me.
Okay.
It's always just been me.
And then, What is it you need the services for? What do you need help with the most?
When I spoke with Edna and stuff, I think we determined that it would be best to do for sure the meals. That would be extremely assistive. That would be probably the biggest thing,
Okay.
especially financially and stuff. I'm only on Social Security. I only receive $967 a month, and I don't have really the ability to do any of the, that on my own as much. And so
Okay.
that's very prohibitive, especially if anything gets worse, like I need another round of chemotherapy or anything like that. I'm just not gonna be able to handle that. So having the meals set up and start with that would just make everything that would be the 2 meals a day that's gonna be the biggest thing. And then I think I discussed with them as well the having someone come to help clean and stuff every once in a while. I don't think I need much with that. I only need minimal, you know, amount for that. But so whatever you guys want to do with that. But the cleaning and things, I'm really not supposed to be doing that. It's I was a lot more functional and stuff in like high school and college and stuff. Whenever I had other people were doing all of those things, but I don't have that now. So
who all lives here with you?
Just me.
Okay.
And then so cleaning and stuff it's pretty minimal. I try my best as well, but like I really can't handle it physically most of the time, especially not if I was
Have you had
going
any
more therapy.
long-term stays in the hospital for over a week in the last 5 years?
No.
Okay. And any mental health or psych facility in the last 5 years?
No.
And so I hear chemo. When was your last round of chemo?
September of 2008, but they consider it current treatment because they keep it current until you need another round because you got an infection or something.
And
they just monitor
cancer?
it. Left ankle in situ. And it spread the distant sentinel lymph nodes all the way up to my brain.
And then, do you have any nurses coming to the home or any home health? Okay.
If anything were to be done, it would be y'all, I think.
Okay.
I have the ed nurses and stuff that come, but they're coordinating other services and things. Mainly, it seemed like with y'all, where I did the application with them and stuff like that, and coordinating other medical things.
Have you ever had a seizure?
Yes, I have epilepsy.
You do have epilepsy?
Yeah, I just spoke with my neurologist last week. My new neurologist, I see her on the 1st next week, and she said I do have generalized epilepsy. That was what her diagnosis was.
When did she make that one?
Last Wednesday, I guess. But I mean, it's been made since the general diagnosis was established in June of 2008, though. So,
okay.
And it was made clear by her superior, Dr. Nalishek, that I have always had epilepsy. My seizure threshold was just, as she explained last week, lowered with my cancer treatment in some regards and the damage from that.
Are you from this area?
Yes, ma'am. I was born at Lakeview.
Okay.
In the NICU.
Do you have family in the area close by?
Yes, but they don't help me.
Okay.
Yeah.
No friends or anyone?
I don't have anyone else. Anything with family would be a bad idea. Like my mother just showed up yesterday with like her, I guess, acquaintance or friend that she brings by, and they kind of just harass me sometimes, and she's
just not a healthy relationship.
I know she's straight up abusive. She's been physically abusive and dangerous in the past, and I think she's just getting old, maybe, or something. I don't know. But they showed up yesterday and were exclaiming that I had apparently never had cancer and things, and I had to call the police, and the police had to come and bring her out and stuff like that. So it's not very healthy at all. I don't know what was going on with any of that because it had been months since there had been any altercation, since the spring, I guess, and so I'm not really quite certain, but it's definitely not a safe thing with her.
Okay.
Yeah, there's no one who would be able to provide things in lieu of services or anything like that. It's just not gonna happen. It's just me.
Okay. And how is your hearing?
It can be not so great. It
Mhm.
depends. I have frequent ear compaction, in both ears, due to I guess like earwax and things, and possibly being born like very very extremely premature. And that's I have to every 6 months have ear canal surgery, which I do, and uh, that usually is it fixes it for a certain amount of time, but sometimes it doesn't because they're they're not able to like surgically remove the earwax due to its like proximity to like the actual eardrum, or sometimes it's stuck on the eardrum and they can't physically remove it without causing a tearing or something like that, which wouldn't be good. So they have to wait it out, and so I might not hear very much at all in 1 year for another 6 months or so.
Is it a specific ear or is it both?
Both, for
Okay.
sure. But depending on how the surgery goes, it could be one or the other in how well the hearing is. So it can really depend.
Okay. What about your vision? Do you wear glasses?
Yes, yeah.
Can you read your medicine bottles with or without the glasses?
I can read the medicine bottles with or without glasses, yes.
Okay.
My glasses are for seeing, like,
Mhm.
like here to like not that light switch, but well, maybe that light switch, but maybe the real light switch for seeing like that kind of a distance, and especially with light, with like street lights and stuff like that. Back when I drove and things like that, would see like kind of a aura around the light, like I do right now. Like if I look at that light, like I can see like light kind of like refracting around the light. Like it doesn't look like a normal light should look. And that it's super prevalent if it's dark outside. If it's like 7 or 8 p.m. and there's no other cars on the road really, and you're like in the front, and then there's like a red light or something. It it's very like.
Do you
blurry.
still drive?
No, I haven't driven in years and years now. Like almost 10 years. So it's so that's not you know as much of an issue, but I still need my glasses for the same to fix the same reason, because the clarity with like or without that is pretty drastic. But it's mainly just like lights that are the huge issue, and because of just like where Louisiana puts like the street lights for like the red lights and the green lights, and like in like you at the front of the car, that's like that distance, and then it being up is really the sweet spot for when it is super bad. If it's a little bit closer, it's not like quite as terrible, but it it's like it is really bad when it's at that distance.
Okay. What about let's see. Let me go back here. No medicine changes in the last 2 weeks. Okay. Do you feel like any of your meds should be changed?
No, not really.
Okay. Do you ever forget to take your meds?
I mean, if I am too exhausted or like too many things are happening, like or too physically stressed, due to just like the circumstances, um, it the more things that can be done for me that I don't have to handle, the better. So the more of those things that I do have to handle that will overtax me, the much more likely for that to happen. Yeah, that can happen, especially if it's something to do with like my parents or my mother, and then them coming over physically and doing what they normally would do. Yeah, that for sure, because I might be out unconscious sleeping for 24 hours.
Now, do you you say you stay here by yourself? Do you have any relationship with your neighbors, or are the gates closed? Like, so what I'm trying to understand is, do you allow them over sometimes, or you don't want them over?
I don't want them over at all.
Okay, and
But I
so
can't do anything about it, so it's just
just
better not to talk to them about anything or speak with them or interact with them.
right.
That's what I was told by physicians, and that's what I've been told by law enforcement, and that seems like that's the best option.
Mhm.
My father doesn't really speak with me anymore. I don't know if he speaks to anyone. He has Alzheimer's dementia now, so I haven't really seen or heard from him in over a year. My mother is the only one who comes around, and I don't know, she's usually not very functional seeming when she does come around, or sometimes she is. I, I don't know, it's just better. I was told to cut her off, and because of what she's done just this year, so that's what I'm just trying to minimize contact, and I feel like that is the best thing to do, is to do that. That's the healthiest thing. But I don't have any way to prohibit her from being around. But
what about siblings? Do you have any brothers or sisters?
I do. I have a sister, but we don't have contact either. But I mean, I don't. It's probably partially to do with everything at home. It's not like we had a bad relationship with each other. We didn't fight. We didn't have arguments. We didn't have any real issues together. But our home life was more controlled by the circumstances with our mother, and so I mean, like, that's probably carried on to young adulthood. She's married and she's out of the state now, so it's she got out basically. That's all. I don't really bother her, and she doesn't really speak with me, I guess.
Okay. And what about let me go back through the rest of the diagnosis we have, just to make sure we cover everything. No issues with your heart, coronary heart, AFib, congestive heart failure, or COPD?
No, my family has a history of congenital heart failure, though.
But you don't have that diagnosis?
Okay. No, and they've checked me, and they don't think I will have it in the future due to my own circumstances, but,
Okay. Well, no, we're just taking account of what's going on currently. So any traumatic brain injuries?
I mean...
That's diagnosed.
Like,
they'll have it.
It would be a specific diagnosis of traumatic brain injury. I've had severe concussions before and things, got hit a bunch of times, but it hasn't been that, and I mean, that could happen again in the future. That's one of the concerns about, that's why I'm no longer living with my parents, and
right.
Because my father has Alzheimer's and things like that, and my mother has a history. So I mean, like, it's and there's just issues with me falling because of my epilepsy and stuff like that. So it's just.
When's the last seizure you had?
But I don't think I haven't so far had a traumatic brain injury because of epilepsy yet. In every concussion I've had, or indication of concussion, was because of a blow to the head in some regard. And they didn't. And whenever I was like in took or and stuff, or saw a doctor, they didn't think, because of wherever the placement of the bruises and things were, that it was from a seizure. They think it was from something else, and that meant someone probably hit me, and they just don't know what the context would have been, because I just didn't remember. Or just other things were going on at that time with medication and things like that, and they didn't really, they didn't investigate further. They just were like dropping the subject. But I don't think anything landed me in the ICU or anything like that, or at least I don't remember. So
well, we're talking about currently, right now. So
current, like, it's the present concussion now. There's nothing current.
Okay, and when was your last seizure?
I don't know, like last week maybe.
How often do you have them?
If I'm not on my medication, I guess. Like, I didn't have, I need the dextroamphetamine, Adderall, and the Depakote, the valproic acid, to stop the seizures. And if I don't have one of them, I could still possibly have a seizure.
So, where's your seizure medicine?
Right there.
Which one?
This.
So, no, you're on a combination and not one seizure med?
This is one anti-epileptic medicine, and this raises my seizure threshold. And this medicine I didn't have for half of last month. And this medicine, if it doesn't work for 24 hours, this medicine works for like 16 to 18. And if I'm not on this medicine, so there's still like a gap that I could have a seizure in most days if I don't have the medicine.
So what's your protocol when you have a seizure?
I wake up and then I'm fine.
So how long are they? I mean, because what me, what?
Grand mal seizures would be usually what the seizures would be. So it's and that I normally whenever it would happen, because I do have narcolepsy, I would be laying down anyway. So it's usually not much of an issue. There's very rare times that I've had a grand mal seizure that I've even been standing up. So it's not normally been a problem, especially since I don't drive. Um, and it's that amount of time that it could happen is drastically reduced because of those medicines. But sometimes I don't have those medicines, and whenever I sometimes don't have those medicines, is whenever the chance goes up by a lot.
Okay. Have you ever had a diagnosis of Parkinson's or a stroke?
No, they thought I may have had a stroke, like in 2018 or something, but they weren't able to confirm that. That was most likely side effects and severe side effects from something called Xyrem. I was in their REMS program, and they tested a special subtype of it that they hadn't released yet, and they wanted to see if I was a qualifier for that because of genetic factors and some other things, and it had the opposite reaction, and they pulled me off of it immediately. But they observed stroke-like symptoms. They had palsies. I couldn't grab things. It was a lot of other things were described to me, but the main thing I remember was not being able to grab things and dropping things at random, and standing there and stuff like that. That was when I had started to kind of recover from it, but when it was even worse than that, they had thought I was possibly a stroke victim, but so they put me with the stroke clinic and stuff like that.
Okay.
But they still weren't able to confirm I actually had a stroke. It was probably just a medicine due to how expedient I recovered type of a thing. It only took 6 months, so that's not really stroke circumstances, I think, is what it was expressed to me. At least not from how severe the symptoms were. The symptoms were far more severe than the recovery time would have probably ever been.
And so the cancer is in your left ankle and your C2?
Yeah, left ankle C2 was how it's always written down on paper, and it spread to distant sentinel lymph nodes.
What's the actual term of the cancer that they...
Stage 4 malignant melanoma.
Say it again?
Stage 4 malignant melanoma.
And do you have any paperwork with them showing that diagnosis?
Yeah, what exactly do you want? I've got a lot of paperwork.
Does anything showing how they code it? Because the coding for cancer can be very diverse.
Yeah. I've got the prognosis. Is that fine?
That'll work.
Okay, it's going to take me a minute, but I'll print it out for you.
Do you you said the last 0909, and then the next one would be she's scheduling to see how many sessions. Probably be October.
October the 8th.
Okay.
Yes, ma'am.
Just wanted to make sure I put it in here right. Okay. All right, let me go back up to here. I was putting in everything we kind of talked about. Didn't have to go over it again. Well, what about? Do you do anything outside home? Church, bingo,
Nothing.
anything that the apartments may give?
Nothing.
Community based?
No, there's nothing that I know of that this, so, these areas, the neighbors, anything provide. I've never actually,
How long have you been here?
3 years almost.
Okay.
Yeah, 2, 3 years. My family owns this property, and, that's
What
when I moved.
property?
This one. We own this
Is
one.
this like a condo? Considered a condo?
Yes, it is a condo.
Okay.
Yes, yeah.
And then, so, does your mom own it, or who? How do you pay
My
bills?
father owns it. I pay them. I have a lease. I pay them rent.
Okay.
I pay for everything else too. Yeah.
Rent, light.
That's all included in my rent, and
Okay.
I pay for the internet and stuff. That was supposed to be included in my lease, and it is included in my lease. But my parents just decided to stop paying for it because my mother just does that sometimes, and then now I pay for it separately. But that is still, it's still in the lease as the included. They just don't want to do it anymore, and but that my father also may have screwed the contract up with that because of his dementia, and gotten Charter Spectrum to not want to any longer have a contract with my father. So there might not also be anything that they can do because of him. He probably ended up calling them or something and got mad and yelled at them or something, and then they decided to not deal with that anymore. I could definitely have seen that happening because the original internet contract things were with him, and he used to handle stuff like that. But I started to handle things like that more. But they probably ended up showing up to the house or calling him to try to refinance or redo some sort of rate or do something else, and that was too much for him. He shouldn't have. They probably shouldn't have initiated something, and then he probably shouldn't have contacted them. Because they ended up contacting me after that, trying to collect on their rate under me, and I.
Do y'all have the same name?
Wait, same last name?
But not the same first name. Okay, well, then they shouldn't be able to do that. But
I told them that, and they were frustrated with that because it clearly was something like that they were at fault initially by contacting him because you're not supposed to be able to contact the utility holder with the contract to try to get a better rate for your company. You're not allowed to do that, and the person who was calling collections from Texas clearly knew that, and they were frustrated at their own company. And I had already had a new contract with them, and my new contract was I was going to get the best rate possible because I just had too much experience in, with my background in software engineering for them not to just give me whatever they could, because I'm actually going to check the rates and stuff like that because it'll affect me. And I've already had a decent relationship with their techs who come out to fix things. Every time they have someone like me around who really uses their services and checks, they end up benefiting all of their other units. So they like having someone like me around. They don't like having as many frustrating, calls and stuff with someone like my father or my mother. So it might just be better for me to be the account holder from now on. It's just something but that's another financial hardship on me because that is a lot more a month, even if it is a lot less than they were paying.
Right.
Because I got mine to $70 a month, and theirs was $190 or something for some reason. So it's a lot less.
What about the let me see. Let me go back to. Okay, let me make sure I got all your diagnoses in too, because I got that one now. I can code it. Any diagnosis of anxiety or depression?
No.
Bipolar or schizophrenia?
No.
Post-traumatic stress disorder?
They were evaluating me for it, but they didn't officially diagnose it.
Okay. And what about pneumonia or UTI in the last 30 days?
No.
Any diagnosis of got cancer, diabetes or kidney failure?
No.
Any surgeries in the last 3 months?
No surgery. Well, I don't know, dermatology things? Might not count.
No. What about any falls?
No, I didn't fall.
Okay. Any issues with dizziness?
No.
Do you have any challenges with it? Okay. What about chest pain?
No.
Any issues with acid reflux?
No.
Like gas in your area after you eat?
Oh, well, yeah, that's why they prescribed the Famotidine, yeah.
And so, what about constipation or diarrhea?
They do have a prescription for me that I just am not currently taking, but I have as I needed. I didn't bring that one down. And I also
Don't worry, it's probably PRN. Have you had a normal bowel movement in the last 3 days?
Yes.
Okay. But which one do you usually suffer with, constipation or diarrhea?
Diarrhea from milk protein if I am eating something like that, but I'm very careful, so usually that doesn't happen anymore. But I also don't eat out or anything as much, or I don't leave, or I probably eat enough food, really, because I don't have enough money. So if the meal service it has like that allergy taken into consideration in some regard, then there shouldn't be any issue whatsoever. But because that does cause severe diarrhea, like I'm gonna throw it up basically immediately.
Have you had any vomiting?
No, but I haven't had any of like the milk protein in a long time. So.
Okay. What about do you get at least 6 hours of sleep every night?
I have narcolepsy, so I sleep constantly. If I'm not on, like I'm right now, I'm on my Adderall, but I only have 6 hours of efficacy time on my Adderall per day, unless if I have any caffeine in my system or other interactions with medications. If I'm not on it in that time frame, I'm technically, from a legal standpoint, I am asleep. That's why I can't drive and things like that. So I'm asleep at all times that I'm not on the medicine, because that's just how it works. I have that much brain damage.
And so, any issues with you feel like you get too much sleep?
Yeah, I guess so. Narcolepsy, I just always sleep. I'm not able to do anything normally because of that. I mean, like I'm much better off when I'm on my medicine. I'm able to do as much as I have ever been. But when I don't have it, it's a huge problem.
In the last few days, have you had any challenges where you felt you slept more than when you use the medicine?
Oh, like something interacted? No.
Okay.
I have felt that way before with medication interactions, but that hasn't happened in quite a few years. That would happen sometimes if I wouldn't have it when I was on a seizure medicine. It would have like almost an allergic reaction or something, and they weren't able to figure out why, but fast enough. But they didn't want to keep me on it, so they would take me off it as fast as they could. That happened quite a few times in high school, where they knew the Adderall was working. They didn't know they hadn't gotten me on the Depakote yet, and they were trying to find a seizure medicine, and there were a few times there that did happen, and I would just kind of be unconscious for like a week, and then I'd go back to the doctor, and the doctor would ask questions like that, and then they would start almost like putting me in like the emergency room to monitor me.
Okay. Do you have any current pain?
My head kind of hurts, but I'll probably take some acetaminophen and some Motrin soon, and then eat, and then probably be fine.
Okay.
When I have more pain, I take, which I didn't bring down, but I have 5% lidocaine patches that I am supposed to use for muscle spasms and to like relieve tension on my shoulder. which has had reconstruction from like 3 months of dislocation, full dislocation. So that's typically what I need, something like an anesthesiac or something. If I'm actually in pain, I don't take actual pain medicine, like any oral pain meds. Usually anything more than just the like 650 milligram acetaminophen, it'd be 12 or 1300 milligram acetaminophen. Sometimes, most of the time, multiple times a day. But I was told to do that by a cardiologist as well, because that was the regimen my grandfather was on, and he was the one with congenital heart failure, and they just kind of wanted me to be on almost a constant, because they tested my liver and things like that, and they thought I was just like my grandfather and going to be healthy enough with my liver to handle the regimen, and they wanted for my heart for me to be on that as well. So I take it kind of as needed at that dosage, like they told me.
Okay. Do you ever feel lonely?
No. If I can be more active, it's because I'm on my medicine, and and probably have other things handled, and I try to speak to people every day, online, friends and stuff that I've just made through school, and things like that, and branching out from there, and still have contact with constantly, and I usually spend multiple. I've been encouraged by my physicians to usually try to spend all of the time I have, like, on my Adderall, to spend with friends playing basically video games, since I am retired, and not to use it on like work anymore, because I'm not in school. So I do listen to them, and I do that, and I think that I have been less stressed because of that. Whereas in the past I was not doing that because I was in school, and I didn't really spend that as much time with people. But now I spend a lot more time with people, or I try to spend a lot for me of time, and I think that I'd say I'm pretty happy because of that.
Okay. And do you have? Let me go back. I said anxiety. I got anxiety, no diagnosis. Any intellectual disability, autism, Down syndrome, um, attention deficit, ADHD.
Yes,
Which one
ADD was
ADD.
what I was diagnosed with.
Okay.
But that's pretty typical for narcolepsy, because they're the same region of the brain.
And then what about, let me go back. Any accidents, urine or bowel movement, or do we get to the bathroom on time?
I don't have any issue with that.
Okay. And what about how would you rate your health? Excellent, good, fair, or poor?
I mean, I was able to get at least back on the seizure medication, which earlier this year I wasn't on, because I had to switch physicians, I guess, and it's taken me a very long time, and I see my new physician next week. So as long as that goes well, and I see that new neurologist next week, I'd say, fair maybe, but that's probably not. You might just want to put poor, just because I'm still a cancer patient, and
do you smoke or drink?
Missing one prescription means that I won't be eating and don't have anything handled and stuff like that. No, I don't smoke or drink.
Okay. What's your height?
5'7.5", I guess.
And your last weight?
Or 5'6" something, because MD Anderson said 5'6", so you might want to put 5'6". Last weight, I think it was 114 pounds. So I've been doing a lot better on weight since I've been on the estradiol and the spironolactone, a lot better. So that because of that, and handling more of an infection with this, like, doxycycline and stuff, that's been better over the last few months. So that 114 might seem low, but that's pretty high for me.
Okay. What about any issues swallowing or chewing?
No issues.
What about, do you wear your own teeth or dentures? Just standard question.
I have never had teeth pulled.
Okay.
I have a permanent retainer because
Do you
of
have
my
any
epilepsy.
broken or loose teeth?
No, my retainer is loose,
Okay.
but it is very loose. And I was supposed to get a new one, but I've been having issues working with dental stuff because the dental stuff didn't want to bill Medicaid and things like that. And I don't really know what to do with that. It seems like they just wanted me to pay them in cash, but I, of course, don't have the money to do that. I'm not really supposed to. This Medicaid does pay for the procedure to replace my retainer, but the dental office didn't want to bill Medicaid. I don't know why.
Okay. What about any issues with your skin? Rash, skin sores, eczema, anything you feel needs to be noted, even if it's not a diagnosis?
Like this, I have apparently like cysts or something like in that are being observed by my new dermatologist, and I see her on the 26th of this month, and
You said they are doing what?
they're observing them
Okay.
for melanoma and doing scans and things.
Are they just in your face?
That's one of the main ones that she's looking at, yes. Because that's been there for a long time, and that area was excised for active melanoma. It says right here in 2008. So that's when that started. So they're looking at that site again because of its, it being kind of popping up and things like that.
Mm-hmm.
And they did the procedure they do for babies in the womb. That one, it's just the name's escaping me. That scan, whatever that scan is called. They did that like earlier this month or late last month. No, late last month, like in the last week of August. On the back of my head and they found some benign mass inside of one of my lymph nodes, and that they're trying to determine what they're going to be doing for that. They don't think that is metastatic right now, and they sent that to my oncologist, but we'll see. That it could end up being found metastatic. If it's melanoma, it would definitely be metastatic, but since they didn't see any other things around it, they didn't think it was melanoma, and that's probably correct, because melanoma doesn't spread to just one spot and then leave every other lymph node. That's not how that works. So having one large enough tumor that it's visible and causing problems inside of a lymph node is probably benign and something else, and they're going to determine what they want to do about that in the coming weeks and months, I guess.
Okay. Have you had a need for a colonoscopy?
Yes, I had one in 2020, and I had one in one or two, and right after my infusions, maybe one during my infusions, and one after that. So probably 2009 and maybe 2011 or 2012.
Okay.
I think so.
Any issues with your feet?
Because I've had ulcers because of my because of the intron A alpha 2B infusions.
Okay. And any issues with your feet?
Like calluses or anything like that. Yeah, no. Besides the melanoma.
Mhm.
No.
Okay.
And sometimes they do snip off part of my toe or toenail region and skin because of melanoma and finding regions that they need to test.
Mhm.
So that can happen, and then it might be hard to walk, but then I recover. And that last time that happened, that was 2021, 2022 maybe, and that was on my left big toe, I think.
Mhm. What about have you had a dentist exam last year?
Yes, ma'am. I had one in the last few months.
What about an eye exam the last 2 years?
I'm supposed to be seeing them every 6 months for a full melanoma check, because that's where melanoma spreads, and they're supposed to check that every 6 months and rotate with that, but I have not been able to see them in a year, or over a year and a half, so I'm still trying to get in to see an ophthalmologist somewhere that will be able to see me again. We used to go to UMC, but they stopped seeing me, I guess, so they I don't know, I saw them for like half a decade for that. And before that, I saw Children's Hospitals, ophthalmology, and for CHNO. And then they opened the ophthalmology department at UMCNO, and then they opened it for melanoma stuff for screening with their residency, and then I was able to go there, and that started probably like, I don't know, 2018, 2019 maybe, and then just in like, I guess, summer of 2024, I guess was the last time I saw them there, and then they stopped seeing me, I guess,
Okay.
for some reason.
What about any vaccines? Do you do any of the flu or pneumonia?
I think I need my next flu shot, but I do see my primary care provider, nurse practitioner, Tran, in like 2 days, in like the 24th.
Okay.
Yeah. So I can probably ask for a flu shot then, because I haven't had one this year, I don't think.
Okay. What about any, so no current chemo,
No new infusions, but the previous infusions are still considered current because the interferon, like, it doesn't go away.
Well, what we're asking is if you had one in the last 3 days or 2 weeks.
Oh, no new infusions administered in the last 2 days or 2 weeks. Yeah,
No
correct.
chemo, no dialysis.
No radiation, no.
Okay. Just wanted to make sure I didn't miss any. No transfusions in the last 2 weeks. What about cut the speech? Alrighty, so, alright, what did you have for breakfast this morning?
I didn't eat anything. I ate something at like, I don't know, like 4 a.m. or so.
What did you eat around that time?
I think it was 4 a.m. or maybe it was earlier and I just went to sleep. I don't remember. Oh no, it was earlier. It was last night, like 11 or 10 or something. And that was like rice and beans.
Okay. And what about lunch or breakfast yesterday?
Rice and beans. The
Okay.
same rice and beans.
And where'd you get that from? You made it? Okay, I was just wondering, do you use the stove?
To basically just make that dish recently, yeah.
Okay.
Yeah.
And then what about, you can use the microwave or thing to warm up food. I'm just trying to kind of gauge how you've been eating in the last few days. Has it been sandwiches or
I don't have
finger
any
food?
money to buy cold cuts or bread.
So that's why I asked, instead of assuming, what did you eat? So red bean or beans and rice yesterday and today, the day before that?
Same thing.
Okay. And then as far as any housework, any laundry or dishes, who's been able to help you with doing any of that?
No one ever helps me.
Okay. And in the last few days, no one's been able to help you with meals, drop anything off, bring you something?
No one ever does anything like that.
Okay. And so no relationship with any of the neighbors where they would?
They don't do anything. I wouldn't bother them with anything
Okay.
like that. I'm not going to bother them with anything like that. I'm not going to go and ask them about helping me out with stuff like I've been told to do in the past in Boshen. That's happened when I was younger, and that was dumb.
Okay.
I'm not doing that.
And so as far as Any how do you do your groceries? Are they delivered?
Delivered with
Okay.
Walmart Plus. I get Walmart Plus half off for annual subscription through through Snap.
Okay.
But I do have the lowest amount of Snap that they can give me, which is $63 a month. But that's still been very helpful. Like that's been the only reason I've had food to eat. But I don't have 3 meals a day. I just usually have like one.
What about any of the food banks in the area?
They don't help me. They don't have. And Edna's been trying to contact and coordinate with them. They have not been able to help me either. They basically said to come to y'all and get the meal stuff, or had nothing.
So have you? I'm not sure how Edna's helping or what involvement it is. We don't do meals. So let me clarify that, and I'll show you in a minute what we do because I keep hearing you say that, and I don't want to continue to give off the wrong.
They spoke about meals.
I'm gonna talk to you about it. Give me a second.
Phone.
I know. I'm about to explain it to you. So there is a program called Meals on Wheels. We are not the same place. I'm not sure if they have any affiliation with doing that, but it is connected to Medicaid. I don't know what the discrepancy or the requirements. I don't know any of that. But most of our clients go through Meals on Wheels. We are then in turn asked to give off food banks in the area, in general, area base that we can look up that would offer food assistance. The only thing we offer.
That is one of the things. And they were on the phone with them, but I think that was why they wanted us to go to y'all, because then y'all's person or whatever would then be able to go to them and then pick up the stuff they would provide to me.
Right, we provide a worker. We do not provide.
The worker would go to them. And they just needed that worker to be like assigned to me so that they could then go to them, because they already approved me for the meals and stuff through them if I can get y'all's worker, basically.
Okay. So that, as long as that's clear that we do, because I don't want to make it seem like we come with meals. It's actually the services that the worker, if approved for services, we approve from anywhere from 18 to 32 hours, and then that worker can in turn help with eating, bathing, dressing, grooming, light housekeeping, cooking, shopping, laundry, housekeeping. Appointments.
Yeah, they can pick up the 14 meals from the charity that they were talking to.
So I'm trying to explain to you what we can do, because they're giving you, I feel, a synopsis of different programs together. Would we provide you a worker? We're not mandating that worker that they can come and do anything. It's based on the agencies. There are some agencies that allow their workers to drive. There are some who don't. There are some that, when we put transportation in here or we designate transportation, it is assumed that the worker can go with you on transportation rides, whether it's yours or public. Now, again, agencies have the choice to have their workers with transportation.
Can I request a certain agency that fits my needs?
It's a whole list of them that you can go through and do the research on who would allow their workers to drive. They have stipulations in place where they have to have insurance and things like that set up, but it's only specific ones. We don't know what we don't designate because the state does not mandate they have to have that. We pay the agencies, and then agencies pay the workers. So it's based on the agency if they'd like to have their workers with transportation provided, but then there's some that say, no, we don't want that liability, right? So you'd have to go through the list and just determine who would give that additional service. Because when we as a state give you that, and how is it worded? Help finding transportation for medical appointments. And then
I don't need that.
I know, but even if you are approved, you'll see, and we've had that over years, having to re-clarify that. There's a line that says, like I'm typing up one now, transportation. And we have to go in, wrong line, this one. So for instance, where we say transportation, hands-on assistance with getting in and out, whatever vehicle that is. And we've had to go and reword it, because when I used to work for the agencies, we actually had to call state. What do y'all mean? Because it made it seem like we made them get transportation, when a lot of agencies workers don't have the capabilities to even get that sometimes. But again, how you gonna get to work? So that was one of those stipulations where it's not a mandated thing from the state. The agencies have the discretion. So there's some that does allow it, and that's where you just go. And I'm telling you, there's about 30 on the list. So you have a good bit of list that you have to go through. You're probably gonna find more that don't than do, just because, again, like I said, that liability of having to keep them with insurance, making sure they keep it on board and they have a good driving record. That's an additional step for them. But there are some that do it. I can assure you. They can bring you places. They can drop you off, not drop you off, but like they can transport you to non-medical places, but it's based on the agency. Now, when we, like again, when we do it, we would have the expectation that either the client has their transportation, whether it's family or their own, they can let the person drive if they want, that's still not up to us, or there's medical transportation come and get them, and we're accompanying you. Everybody's needs look different. It's not always about mobility, but sometimes it is about just being accompanied to the doctor. But that's where we as a state can only mandate that they accompany you. Because when it comes to the doctor, that's like one of those, things where they don't want to be liable because transportation won't pick you up and put you on a thing, help you on, like, as for instance, if you had a walker or something. They can't be liable to touch you, so we then in turn meet them at that threshold. They transport, we help the person.
I don't even need them to transport me to non-medical things. I just need them to physically, on their own, to go to the charity, just make a pickup, and then bring me the meals the charity's already assigned to me. And that's because one of the charity stipulations was they needed, I guess, the worker from y'all, and or else they didn't want to make the meal or something. And so it seems like that's all handled, so they just need the person to go and get the thing, and then bring the thing to me, and however that charity, I don't know if they do it like once a day or a week or something, I'm not sure, but it might be every day, and then they just have the 2 meals, and then the worker would drop the 2 meals off for me, and then I would have the 2 meals, and then the worker could maybe do some light housekeeping on that list, and then that's probably it. It would be maybe sometimes I'd like to go certain places, but so I would want the transportation options, but I'm not going to make that 100% requirement if I want, because it would be, because it might take the worker a long time to go get the meals and bring them back, and that's the most important part, is getting that. So if that takes up the worker's allotted hours, that's what I want it for. Because that's the priority, because that would fix a lot of other problems that have no other services available, no other options for me, nothing with Medicaid, there's no ability for me to get independent food, I'm not going to get more money from the United States, it's not going to happen. So like the allowed and offered thing is this system with the worker getting the stuff from the charity, and the charity exists, and they work with y'all with these, I guess, workers.
We don't work with the food banks.
They're not a food bank. They're a different.
Or a charity. We work with you. That's what I'm trying to say.
Well, they're the ones who work with me, I guess. But they were on the phone with Aetna, and it seems like they directly hand meals to, I guess, these assigned people, and not me.
They have to be their assigned. We don't assign people to their charity. That's what I'm
You assign the person to me, and then I get the charity to coordinate with the person, I guess. I'm assuming is what happens.
You're assuming, and I'm trying to explain to you what we do.
Well, because I was talking to the CEO on the phone of the charity, and the charity with the Aetna worker here.
And somehow, Aetna and that CEO for the charity should have come up with some other game plan, because that's not how we work. Because we do allow you to get a worker, and I'm explaining to you what we offer is nothing to do with food. They can come in here and prepare food for you, whether they get it from the grocery store, you have it provided, whoever provides it. But we are not designated to go and get.
Yeah, but they could go to this place to get the food that's provided, right?
So what we'll do is complete your assessment, and then at the time that you are approved, if you're approved, you can then sit down with the agencies, and they can discuss with you what they offer. Because I don't want to sit up here and tell you they can't and they can. I just explained to you that there are some that would allow that and some that don't, but that's not a mandatory.
Well, I'm not saying you're wrong at all because of your experience. It's just maybe that organization, which is I guess the only organization around here for St. Tammany, has just never actually really interacted with y'all directly, which they probably haven't. They've probably always gone through some other thing, and it's just not been as big of a deal. Maybe everybody's been considering them some sort of grocery place or something. I don't know, because it sounds like from what they do, they package like a meal or something that can be prepared or heated up later, and then maybe the people have just always been preparing it for the people in their homes or something like that, and no one's ever like mentioned it. It seemed like I was like the first one that Aetna had ever interacted with that needed to sit down and possibly like get this charity to be like a contractor for them or something. They hadn't had that done before. The charity mentioned that they had tried to speak with Aetna like directly, but hadn't gotten the chance to do so until me, and that was only 2 weeks ago, so or 3 weeks ago maybe, on the 9th. And then it's probably been a very short time frame of sorts. But it sounded like they were doing what they had been doing for many, many, many years, like most of my life, and that the people that they probably were interacting with were somehow these workers in some way, and it just was made out to sound like that there was some sort of a like super established relationship between them and the state through y'all, but maybe that had never really been like established, because they never did explicitly say that. It just skipped that step entirely because of, I guess, the longevity of how long they had been doing their job and what they had done. Maybe that's like one of those, you're the only game in town, so like it's just assumed you go to this one place, and that's how these people just get their services provided, type of a deal.
Well, I'm not sure, but you are definitely welcome to kind of bring back whatever we give you and ask to get guidance from whether it be Aetna or the agencies. But we can go forward, and I have a few more questions, and then we're all done. The last of the questions, let me make sure I didn't forget anything on this one. Okay. Last 3 days, have you gone out the house, even on the porch area?
I got the mail, and I took the trash out on Saturday night, and I got the mail the same time.
Okay. And what about anywhere, like with transportation? When you go to the doctor, how do you get to your doctor's appointment?
Medicaid transportation?
Okay, and then no transportation in the last 3 days?
No, I don't have any transportation besides Medicaid transportation to the doctors. I don't even have transportation to the pharmacy.
Okay.
That's kind of the only thing that would be nice, to have the worker bring me to the pharmacy every once in a while. But
okay, we're gonna get there. And so, what about your bathing? Do you do showers or baths?
I shower. I do that all myself.
And do you ever need assistance with reminders for bathing, or
No.
reminders for personal hygiene? You can take care of all your own face washing, teeth brushing, anything of that nature?
Yeah, everything I can do myself with that.
What about putting on your clothes?
I can do all that myself.
Any issues with, let me see, do you use any walking devices?
No, ma'am, no.
Okay. Last few, and then, okay. How do you sit down on the toilet?
Without assistance.
Okay. What about wiping when you're done with using the bathroom?
Without assistance.
Any issues with pulling up your bottoms?
No. No.
How about rolling over in the bed? How do you roll over in the bed?
I don't move usually because of my narcolepsy. You get into a state of sleep paralysis, and then I don't roll over,
Okay.
or move. Yeah.
Do you sleep in one spot, do you realize?
Yes.
Do you notice what side or what area? Back side?
Back usually, because I was told to do that, so I just go to sleep in that position, or I try to, and then I don't move.
Okay. And what about going from a laying position to sitting up? Do you have to hold on to anything, or you can do it with no problem?
I brace myself sometimes. I don't hold on to like a railing or anything, but I do. I do kind of orient myself in order to do that, so that I won't get hurt or strain or sprain something. Just so I don't get up too fast, or like the blood rush to my head or something like that, because I do, I will be laying there for 20 hours, so potentially, and I do kind of do that.
Okay. What about, how do you put food into your mouth?
Normally.
Okay. And how do you stand up from where you're sitting?
I usually do. I I sometimes put my hand on like a table or something, but I don't need to necessarily.
Okay. All right. I am done with my questions. If you have any more, I'm here to listen. I'm done with your meds, and then I just two signatures on these forms.
You can keep these. I printed out for y'all.
Okay.
Just in case y'all need those as reference. I have the documents. So.
Okay, I took a picture, but I'm gonna bring it with me and scan them into the system.
It's easier to scan them.
And then what about Okay, so this is the packet I was explaining to you with what we do provide. On the back it shows the things we don't help with, like we can't touch the meds, but we can remind you about the meds. They can't do like therapy and things like that. If you have any questions, you can call this number for clarity on the transportation kit piece. Or if there are some specific other questions you have, you can call and ask them, pretty much grill them on everything we offer. This is the long-term care program that you reply to, but there are several others. Community choice, there is adult rehab, so it's different ones that offer different things.
I think the community choice was the one we initially called, and they may have been the one who directed us to the charity with the food and stuff.
So this is where they usually refer you to us because this one has such a long waiting list. This one does come with like the therapy, the assistive devices, and other things. I like to call ours like the great value. We just come with hours and a worker. But that offers all these different skills. However, with this one, you can have the hours alongside with a case manager, assistive devices, if you were in need of them, right? But the devices could look anything like something you walk with to a camera in your home type of stuff. So, just to inquire. But you are welcome to look through any of these programs, apply at any point. You don't have to wait on your decision letter for this one because in the event that you are selected to have an assessment, they'll come right out. Being that all of these are state agencies or state services, say for instance you apply for this one, we'll hold this one in place until this one's approved, and then they'll swap out. They'll never go simultaneously. But you're welcome to apply to any of them and call and ask about any of the programs. Some of them do have some type of housing and funding. These are just some new ones, and every time they update, they have us bring them out so the client can get used to and familiar with them. I'm going to have you sign for your rights and responsibilities. That's right here in the middle of the pack. It just says that you have the right to not be abused, neglected, exploited. Exploitation means anything taken from you, your mail outside the door, your newspaper. You can call this number. I know you called the cops, but you can call this number because this is just another general way to have, I wouldn't say eyes on you, but they can identify your home as when they call, they're not just lagging because they already know it's a record of these people. They're not bothering you. And then when you're receiving services from us, we put it in the system. It's kind of like adult protective services. You report them, and it's not like there's going to be another FBI or anything come out, but it's just that we have it in our system that we know you have some issues that are things we need to watch out for. I mean, it's not going to put your business out like we're going to start waving it everywhere. But say, for instance, you are approved, they will make that client that you're working with, and I'm sure you will once you get a relationship with them. So they are more observing, so they're not walking up and nobody come behind them and come through your door. They'll be abreast to what's going on with their situation. Only on a baseline level where we'll just say, hey, he has some issues with old family and friends doing whatever. You have to take more precautions with when you're going in his home, not going out when it's dark, and if you do, being more targeted. So that's where we'll have you sign for this, that we just gave you your rights, but we ask you to read through them. Because you do have the right. Now, if you don't want to report, that's up to you. Because you've already done it to the cops, so you're not obligated. It's just another area to kind of report so that we're all on the same page with what's going on.
Should I call ahead of time just to make sure that y'all could be like,
they will technically take a report because what they'll do is, say for instance, and I don't like to say this, but if they are in the healthcare system, they're flagged, kind of. So for instance, like if they're getting any kind of services like this, they'll be flagged. Certain people can only go out to their house. It's like a red flag on their system. So especially if they're of an older age, you know they're going to use healthcare at some point, and it's kind of like when they go into healthcare, be cautious of this person because they give issues, is what it'll be like a red flag. Whether it's something towards the person, but everybody around them will just be on moral alert, like, don't be relaxed-daisy with this person, because you could have been manipulated into something or something. But we on the inside...
Yeah, that definitely describes my mother. She's called physicians and lied about
prescriptions
with me before diagnoses. She's straight up gotten into my healthcare portal before and reported certain things, like it said that
because she has your information, like your date of birth and stuff like that.
They had to block her out of the healthcare accounts so many times because she would continue to get access and then change the password and stuff like that.
Well, I'll tell you this. I am mandated where I have to report that she's been here in the last 3 days and you already got a report on her. Now, what they may do is call you and ask, so you don't have to do any reporting, so you can give any additional details. All I'm going to say is during my assessment, my client reported someone was there at his home in the last 3 days that he didn't feel safe with. That's all I do, because I'm mandated to do that.
Yeah, that's what I told the
you, but they'll in turn call you and ask you for more details, because then they'll put it in the system with her name and identifying her, so they know this person can. If she ever tries it again, it'll be pointless.
She usually does things like stand outside my door and like demand I open it and things like that, and I wasn't able to go to the bathroom because until the deputy got here and got them away from the door and things like that. That's pretty typical. So if she's really bad, she could stand outside the door for a very, very long time.
Well, that's stuff we need to know, because again, like I said, we're not going to just, if you're approved, tell the workers so we can scare people from coming around here, but the agency would know to put somebody who is still okay with the fact that you may have some issues with somebody trying to deter you from this home or actually get with you in the home. So those are things that they need to know, so they won't be, oh, your mom, come on in.
Yeah.
You know, because who wouldn't let mom in? The typical person would.
That's understandable. Yeah.
So that's just things we need to know for our purposes of serving you the right way we need to. Okay? Because we wouldn't want to be the ones walking right into your house, and they're like, wait a minute, what did I hire these people for? Actually, to help protect you in an instance. So you're welcome to call around and find out about the other programs, but I will say, once you get into one, you shouldn't have a problem with getting in any of them. All right, and are you registered to vote?
Yes, ma'am.
Okay, so we just asked.
I don't think I'm registered at this address yet, but I am registered at my parents' house.
Okay, well, we leave this in the back because we have to ask for every state application, so you can use this and update it.
Am I required to update it for this
address?
You're not
required, but you can if you want to.
Okay. I just haven't done it yet. I wasn't sure if I was actually supposed to or not because I'm in the same. I think I'm
same parish.
Yeah, I think.
Now, you probably will run into some problems when you go to the polls if your address has changed and they have the address of the old and the one on your license is different. They just been giving all kind of problems.
Yeah, the last election I still had the same identification because I was always using my passport, but I recently got that updated because it was finally expired. They didn't actually allow me to change my passport until this August because of my income and Social Security and stuff. Like, I'm not allowed to actually be required to change my addressing on file with the feds. It's like a law because they don't want me spending $250 on a passport every time I move because I have to have the upper level passport. But now my passport's for 10 years, and so they just now finally were allowing me to change it. So it took 2 years that I didn't have a really updated passport, but now that I do, I wasn't really sure if I had to actually change this because last time I did vote, they didn't have any issues, but the passport's address and stuff was my parents' address.
I would say you may want to do that just to be safe if you have intention on going to the polls and being active, because in the last 2 elections, I want to say they did give people issues with the license not matching. You know, whatever ID didn't match what was on file. So if you had the old address, that was probably fine, but if you go this time without that passport, you'll probably get some issues. But you can do it at any point.
Is there an election in this fall?
Not till... Now, there may be some stuff district and citywide, but not anything...
not federal or anything?
No.
Okay, so I just mail this one in?
Yeah, you can just mail it in.
I haven't done it since I was I registered when I was in 16 or 15 or something like that. So I'm 28 now, so it's been a long time. And these are the are the registered.
So send it to whatever parish is yours.
So I just send it to the St. Tammany one?
It should be on the bottom.
There. Columbia? Okay. I think I may have gone in person back then with my grandparents. That was a very long time ago. And I just is just this form. Okay. Yeah, I can do that.
Okay. And so on these, you'll just sign that I gave you your rights and responsibilities in that pack and that voter packet, showing that we came by, and then that packet shows we gave you our assessment. And so in 5 to 10 business days, you'll get your decision letter in the mail.
Okay, because they already sent me a couple decision letters for this, and they said I was approved for services. Did that mean just approved for like?
To have the assessment.
To have the assessment.
So first is the assessment, and then when you get the second one, this will tell you if you have the services.
Okay, because I got 2 separate letters, but the first set of letters I think may have just been the delayed assessment.
Look in those and keep everything, and make sure they don't have that list of agencies. Because if you have the list, you can start looking through them now.
Yeah, they gave me the list. It said I was approved ahead of time, and then I was also going to receive an assessment. So I wasn't really sure. I mean, I can show you the letter, but it did have.
I know what it is. It tells you you're approved to get the assessment, and then the next approval will be the services.
And I can start calling those agencies.
You can start calling and just to ask that question about transportation to kind of narrow down.
Okay.
So who has the transportation?
So I have to myself figure out which one.
That's the unfortunate thing with our program, because we don't have a case manager. The next one has a case manager who would do that for you. Or you can get Aetna to do it for you, but I don't know how they would cross those programs.
I'll call it and then see if Aetna will do it, because Aetna was kind of they already have like a community health care worker with Aetna. One of them is assigned to me, and then an RN is also assigned to me that I met with last week.
Okay.
So I think they have for Medicaid like 2 people full time being paid to work on my case, because I think they're working through some new contracts or something. They were bringing up something. They're both at the high level like executive stuff for Aetna, and they were trying to make some new sort of Medicaid contracts for the state with I think y'all and with some of these people, because Aetna hadn't done that I guess before.
Okay.
So I'll try them first, because I think I'm supposed to. But is a community health worker the same thing as like a case manager for you guys?
I'm not certain.
Okay, because it seemed like it was like some extra sort of like a social worker kind of. So the case manager for y'all is something different?
Yeah.
Okay. And it's the just 1 second.
And then one more on this page, you'll sign, print, and then date. All right. And so, like I said, in 5 to 10 business days, you'll get that decision letter. But if you wanted to go ahead and start calling the agency.
Is this one for you?
No, this is yours. This is your whole package. It just this is if you want to do a rights and responsible rep. So you just keep it in case you want somebody designated.
Oh, like if I have my parents do it or something.
Yes.
I don't want that.
All right.
I'm gonna not.
Well, that's it for our end. Like I said, in the 5 to 10 business days, we'll send that to your mail. If you want to go ahead and get jump start on the agencies, you can. If not, you can wait till you get your letter.
Okay.
Okay. All right. Well, good luck with everything.
Okay. Thank you.
Yeah, I'm good.
You too.